Welcome to our lecture tonight, The Long-Term Health Complications of Gonad Removal in Small Animals, presented by Dr. Xavier Schneider. Xavier graduated as a veterinarian from the University of Queensland and began his veterinary career working in mixed practice in North Australia, focusing on equine and bovine reproduction. On returning to Brisbane, he completed a rotating internship in equine surgery, medicine and reproduction at the University of Queensland Equine Specialist Hospital. Xavier is currently undertaking a residency program in animal reproduction with the American College of Therogenologists at Queensland Veterinary Specialists and the University of Queensland School of Veterinary Science. Xavier has a clinical interest in canine, equine and bovine reproduction. I'll now hand over the mic to Dr. Schneider.
Good evening, everybody. Hope everyone can hear me all right. Thanks for attending. Tonight we're going to talk about the long-term health complications of gonad removal in small animals. It's a very interesting topic at the moment, this. Controversial somewhat. Changes the dogma a little bit that we, I guess, were taught and teach in vet schools. We constantly talk about, when should we desex, companion animals, and a lot of people want to know an age that we should do that. And I guess that the idea of tonight is to present everyone with the current, literature, review of the science, and then come to some form of decision amongst yourselves about what you think when a client comes to you to say, hey, I have a 6-month-old or a 12-month-old or a 3-month-old puppy or a kitten and, want to talk to you about desexing, you can at least have a comprehensive arsenal of information. We're able to say, this is the science. Let's discuss when we should consider desexing that animal. So I work at Queensland Veterinary Specialists. My email's on the screen there. Feel free, if you've got any questions, to contact us at Queensland Vet Specialists. There's myself and another colleague, Phil Thomas. We're both the reproduction team at QVS. Happy to take phone calls any time and your email, and hopefully we're able to answer any other questions you have. All right, so let's get started. So I guess the first thing we need to talk about is, what is sterilisation of an animal? And it's important because it's something that, we talk about often. We always say, you should desex your animal, but, there's many different ways we can do that. And I guess the first thing to think about, and this is from a therogenologist, right, someone who deals in reproduction all the time, is it's an irreversible intervention that causes permanent cessation of reproductive function, right? So if someone comes to you and says, I want to rebreed from that dog later on, well then, surgical desexing is not a good idea, or removing an ovary is not a good idea. There's many different methods that we can use to desex animals, and most of us would be familiar with an ovarian hysterectomy. There's a few other options you can do as well. In the bitch, we can take out an ovary, we can sever the fallopian tube. In the dog, we can obviously castrate, an orchidectomy, or we can even vasectomize them and leave the gonads in place. And there's benefits for leaving the gonads in place. There's also cons for leaving the gonads in place as well, but we'll talk about them in a minute. There's other methods that we can use to castrate animals as well. We can use GnRH agonist antagonists like the suprelorin, and we can try and block at the level of pituitary hormones that help regulate reproduction. And then there's other options like vaccines that we can vaccinate against those reproductive pituitary hormones. In the dog, not so much at the moment. It's being developed, but for example, in the horse, we have a GnRH vaccine that we can administer. So that might be something that might happen in the near future in our dogs as well. And then there's traumatic methods, which I'm not sure if everybody's aware of, but in some parts of the world with shelter medicine or I guess stray population control, We can also inject fibrotic agents into the testicle, which can be painful for the animal, which can also be non-painful if done correctly, but can render that testicle potentially infertile by fibrosing the tissue and not allowing spermatogenesis to occur. So there's many different ways that we can desex animals, and we need to consider all these when we talk to our owners about what we would do and why we would do the procedure. So you want to cast our mind back to physiology. I enjoy physiology, and I think physiology is really important to know, because if you can understand the physiology, then you can understand, why the disease process occurs. But if we have a quick look at the physiology here, I'll just see if I can get this pointer to work. We should be able. There we go. So we can see we've got a hypothalamus here, and you can see that by the green arrow. So this on the left side is the female, obviously, and our hypothalamus releases hormones, which is GnRH, and GnRH from the anterior pituitary will then release FSH and LH, and FSH and LH will act on our gonadal tissue to do a bunch of things: growing follicles, causing follicles to luteinize, ovulate, but they also release a bunch of other mediators which allow hormones to be produced. So inhibin, which will exert a negative feedback on our pituitary, telling us that we've got enough FSH, for example, and we don't need to grow our follicle anymore. We get more estrogen produced as the follicle grows, which gives positive feedback to our surge center, which then helps us reach a threshold to cause an increase in LH, have an LH surge, and then, of course, ovulate. So if we then go across to the male, and this is the male over, this is the male over this side here. So again, we have a hypothalamus that releases the same hormones as the female from the pituitary, but they just act a little bit differently, right? So they act on Sertoli and Leydig cells in the testicle, producing inhibin and estrogen, same as the female, but we also get more testosterone produced as well. So it's important just to understand how those hormones work on the gonads, how they work with their mechanisms of feedback to the pituitary, because that has an effect later on if we're desexing an animal with what's going to occur at the level of pituitary and what's being released. So if you think about it, and it's a question that I ask regularly to people, what happens to the hormonal cascade when you desex an animal? And it's something that we don't think about. We think remove the gonad so then everything stops, but it doesn't actually stop. There's other things that occur as well. So if you look at the left here, we can see on the left side here, we've got a normal adult mammal. Now, the hypothalamus obviously releases GnRH, and the pituitary releases FSH and LH, and that then exerts a negative feedback regulating the amount of FSH and LH that's further released, right? Now, if we remove the gonads, so if we were to take the gonads out, so on the right here, we don't have any negative feedback, so we just have an increase in LH. So what does that mean, an increase in LH? And it's an area of research at the moment. It's quite exciting, it's quite new, and we think, and it's emerging, that some disease processes LH may play a role in. And it's that increase in LH that we are starting to investigate to wonder, is that causing, or does that have an effect on other disease processes? So the time that we castrate or desex an animal, or spay an animal I should say, is that going to have an effect on the longevity of life, or the incidence of cruciates, or mammary cancer, or whatever, right? So it's important to know that that's what happens when we desex the animal, and that's where the current research is lying. What is that effect on the animal? So why do we desex animals? And at the end of the day, our dogma is because it's due to not having pet overpopulation, right? So obviously the number of unwanted dogs and cats is increasing, right? And we know that, right? And the contraceptive technique of choice is surgery. So no matter what, if we were talking about desexing an animal, 99.9 times out of 100 we say desex your animal. And generally, shelter people will tell you, and lobby groups will tell you, that overpopulation outweighs the risk of early age desexing, which is a very interesting point. Now, it's interesting that in the United States, 64% of dogs have been surgically sterilised, and most commonly this is performed between 6 weeks and 12 months of age, so it's done really early, really early. Now, what do we need to consider, right? So we need to consider now that clients are becoming more educated. So clients are Dr. Google, they're using Google, they're having an informative read, and are coming to us now to our consults armed with a lot of information. Some of it's science, some of it's anecdotes, and some of it's just absolute, propaganda, right? And it's non-helpful. But we need just to be aware of that no longer we can just say to them, oh, well, we should just de-sex your animal, because they're coming to us more informed, right? Now, sometimes de-sexing an animal is convenient to an owner, and we mustn't forget that, right? So some people can't manage an entire dog or an entire bitch, don't want the bleeding, don't want them spraying or marking. So sometimes you need to consider that sometimes convenience to the owner is a consideration for de-sexing. And if it's not convenient to an owner, then that's where we see increases in unwanted dogs and cats going to shelter medicines or strays or so forth, right? Humane societies and rescue groups are also putting increasing pressure on us to de-sex animals. And I mean, this is a population control thing, right? And that's true, and it's good, and we should be considering those things, but we should also be advocating responsible pet ownership. And part of offering responsible pet ownership, we should be offering responsible information and science about when to de-sex these animals for their long-term health benefits, right? So, as I said before, surgical sterilisation is the current treatment of choice, especially in Australia. It is also in the US. However, some countries don't even permit elective sterilisations. They actually legislate against it, and this happens in Europe. Scandinavia, for example, that's a country that they don't advocate for elective surgical procedures. And for example, in the bitch, once a bitch becomes a bit older, potentially gets a pyometra, that's when they intervene to de-sex these animals. So if we think about this, right, we de-sex these animals all the time, and we constantly just, flippantly say, hey, we should just de-sex your dog or castrate your dog. How does that correlate to humans, right? So the hysterectomy of a woman is one of the most common surgical procedures done worldwide, right? And you can see the numbers of how many hysterectomies versus ovarian hysterectomies are performed. Now, in Australia, they surveyed a large number of women to see what the limitations were post-surgery, right? And you can see that there was risks. There are risks that are involved with that surgery, right? And based on this survey that they did and this literature review, they found growing evidence that surgical menopause may have a negative impact on both cardiovascular and general cause of mortality in humans. So it's an area that they're starting to research as well and consider and discuss. And the amount of times now that myself gets called at the specialist centre asking about hormonal therapy for dogs and cats that have been de-sexed is very interesting as well. Again, reading from human literature, they extrapolate from what they can read on the internet, asking, why shouldn't we put our dogs and cats in that as well, when potentially, if that's the case, maybe we should be considering delaying de-sexing and doing them a little bit later on. But we'll talk about that in a minute anyway. So if we then talk about dogs, for example, or I should say small animal corrals, bitches and queens, they don't appear to experience menopause. And that's really important to know, right, that yes, they're born with a finite amount of eggs, just like humans and cows and horses and everyone else, right? But they don't generally experience menopause. And as bad as it sounds, it's because they just don't live long enough. Another disease process catches them before they run out of ovarian reserves. I guess if we have older dogs, it will be the exception that some of them do. And I did see a dog once that I was convinced that it was in menopause, but the dog was extremely old and an outlier in its in its age bracket for its breed, but in general they don't experience menopause. And dogs, but not toms, their testicles are the second most common anatomical site for cancer development, which is very important as well. So there's a wide range of complications, obviously, if we're desexing at different times, and they can affect a number of systems in the body, including reproductive tract, the genitalia, development of tumours, urinary tract problems, metabolism disturbances, and it can affect the musculoskeletal system and even behaviour. And it appears that the time of sterilisation could have an effect on some of these outcomes. So we just need to start to think about considering the breed of dog, the size of dog, the type of dog and cat that we've got, and what would be the best time to desex. So if we start by thinking about the female reproductive tract, first of all, should we be doing an ovariohysterectomy versus an ovariectomy, right? Now, there's no benefit in a healthy bitch removing the uterus during a routine desexing. So if you've taken out all gonadal tissue, there's no hormonal stimulus endogenously, so internally, to the reproductive tissues. Now, if there's tissue and there's exogenous supplementation, that's different. But endogenously, if you've desexed and left some uterine tissue in, it is not a problem. And so, you know, do you have to take the whole uterus out or not? It's not a big deal. If it is diseased, on the other hand, different, right? So if we've got cystic endometrial hyperplasia or we've got a pyometra, then you need to remove the whole lot, the whole uterus, gonads, everything, right? But for your healthy animal that has no uterine pathology, if you take out ovaries only, or if you take out ovaries and a portion of the uterine body and leave part of it in, it's okay. Now, also, having these gonads removed will have an effect on tumours of the gonads, obviously. So dogs are a little bit different to humans, where their tumours are sort of contained to the gonads. So bitches that get tumours on the ovaries generally stay within the ovary and don't metastasize. Dogs, again, in their testicles, generally stay within testicles. The odd one may metastasize, but in the whole, they stay within that gonad. So removing them will have an effect on ovarian tumours and cysts and testicular tumours. And obviously, once the gonads are removed, well, we get a decrease in uterine pathology and disease. So remember, you know, if we leave our gonads in for long term, so we have entire bitches that are older, they will be predisposed to cystic endometrial hyperplasia, which may predispose them to pyometra. Pyometras don't have to occur under the influence of cystic endometrial hyperplasia. They can occur separately, but that predisposes them to that decreased clearance and the pyometra if they've got cystic endometrial hyperplasia due to prolonged exposure to sex steroids further down the track. The other thing too is vaginal hyperplasia. So we see a lot of people talking about uterine prolapses or vaginal prolapses in the bitch. And generally this is hyperplasia of the vaginal floor in the early stages, then protruding to a full protrusion of the vagina alone. Generally not the uterus, and it's rare that the uterus in a bitch will prolapse, but the vagina, you will see that. And if you were to do a digital vaginal exam on bitches in season, you would be surprised the amount of vaginal hyperplasia that's there, which occurs under the influence of estrogen. To fix that, we remove the estrogen that's being produced, and then we're able to, that hyperplasia is able to be reduced. So those sex steroids do have an effect on those on that reproductive tract. So if we look at mammary tumour, right? So malignant mammary tumour is the most common in bitches, right? But in queens, it's less than half, but accounts for about 17% of their neoplasms, right? And spayed animals are significantly less affected. So here's a case where desexing has a benefit for mammary tumour, depending on the time that we do these, that we remove those gonads. So if we have a look here, timing that plays a role. Now, this is in the bitch. So if we were to spay her or remove her gonads prior to her first estrus, there's a 99.5% chance that you won't get mammary tumours, right? If we delay it to after her first estrus and before her second, you can see that we start to reduce our risk of not getting tumours, and we increase our chances of getting tumours. And then obviously the effect's lost if they cycle more than twice. And then after about 2.5 years of age, desexing, there's no more effect of those, no more effect on the benefit of removing the gonads. And that's really important, right? And this also occurs in cats. And queens undergoing gonadectomy prior to 6 months of age, they have a 91% risk of reduction of those malignant mammary tumours compared to their intact cats. And if it's performed after that 1 year, prior to that 1 year of age, they have an 86% chance, a reduction in risk. And if it's performed between 12 and 24 months, then there's an 11% reduction in risk. And in cats, it's 2 years. After 2 years, we don't see the change. So in the sense of mammary tumour development, well, that's important, right? That we might need to discuss that with our owners to say, hey, you know, there might be a benefit to gonadectomizing these animals early. There's other effects though that the gonads have on the reproductive tract. Now, genital tract tumours are rare in the bitch. They are sex steroid driven, and that's really important to know. But things that we do see are vulvar development, and when I say vulvar development, what I mean is conformation of the vulva, size of the vulva, and the genital tract as well. And then that having those sex steroids there to have the effect on puberty really does has a profound effect on diseases and conditions and complications that we see, you know, further on throughout life. So juvenile and adult onset vaginitis is one of the most common causes of, I guess, discharges that we see, well, I see in animals that have been desexed too early. So, for example, there were 2 groups of bitches. Ones were desexed at 7 weeks and 7 months, and the ones that were 7 weeks had small and infantile vulvas compared to their intact dogs. Now, also, we saw, they saw in that study perivulvar dermatitis with these infantile vulvas due to conformation, but obviously there's also an effect with overweight dogs as well. Now, these, it's surmised that these infantile vulvas plus or minus perivulvar dermatitis can have an increased risk in UTIs, you know, potentially some form of discomfort to the bitch, where that might present as they're straining to urinate with a polyuria. However, it might not be that, and it might be that they've actually got vaginitis themselves. And sometimes we see adult onset vaginitis occur later in life as well. And generally, and this is not really reported in the literature, but generally we see that if we leave young females entire for at least a season or 2 longer, or if they've got a vaginal discharge as a puppy vaginitis or juvenile vaginitis, and we let them cycle, we generally see either the vaginitis resolving and the discharge resolving, or we see a reduction in the in that discharge in subsequent cycles. And the pathophysiology of this isn't clear, but we think that the shedding of the lining of the vagina due to estrogen and the mitogenic defect of the vaginal epithelium from that basement membrane and the exfoliation of these cells may have an effect on removal of the of this inflammatory, sterile inflammatory response. Now, we do treat these with estrogens as well sometimes, synthetic estrogens. So what we try to do is, if this has happened and the animal's desexed, we try and simulate that they're a heat and try and force an exfoliation of these cells. But that doesn't obviously change the conformation and vulval development that has been, I guess, delayed or stopped because of the early onset of the desexing. So in these cases, sometimes if we were to look at these dogs and say, oh, that looks like she's got a infantile vulva, we might want to just wait a little bit longer before we desex it, just to see if we can grow out and get a bit better conformation before we do, may also help as well. So if we think about the male, so orchidectomy or castration will cure androgen-dependent diseases. Now, there are medical ways we can do this as well. We can block testosterone, we can block dihydroxytestosterone, DHT, in the prostate as well with medications. But essentially, castration or removing the source of testosterone will fix a lot of these androgen-dependent diseases. And the most common is BPH, or benign prostatic hyperplasia, but that can lead to chronic prostatitis as well. Then obviously there's other diseases we can get, including perineal adenomas and hernias. Prostatic cancer is rare, but they can occur as well. And of course these are all androgen dependent. But what's really important is the size of the penis, the os penis, the prepuce, and even spikes in cats we see are affected by the length of time of gonadal hormonal exposure. So that, again, they did 2 groups, the same as that other study of 7 weeks and 7 months, and they found that the immature group, the 7-week group, was desexed, had small and infantile penis and a prepuce, and Tom's had missing spikes as well. So again, it demonstrates that gonadal sex steroids have an effect on development on the body in the genital tract. And if we've got dogs with infantile prepuces or an infantile penis, might predispose them to complications later on in life. So it's again, it might be something that we need to consider when we decide when to desex our dogs and our cats. So the effect of the lower urinary tract. Now, urinary incontinence risk is low in intact bitches. We know this, and we see due to spaying that it can vary between 5 and 30%. So there's a chance that once we spay these bitches, we can see urinary incontinence within a week or 2 of desexing, but we can see them years later on, and the risk is that up to 30% of these dogs may get it, right? The pathophysiology of this is still a little bit unclear, but it's pointing towards LH receptors at the level of the trigone of the bladder. And they've done studies to section the trigone and see these overexpression of receptors, which they think might have an influence on sphincter mechanism leading to incontinence. Now, we do know, though, that obviously this lower urinary tract disease is influenced by body weight, breed, time of spay, and the procedure. And I write "and the procedure" because if we're spaying dogs with a really small hole and really putting pressure on that uterine tube to exteriorize it to clamp and desex, we're also causing stretch of the bladder, the ligament of the bladder, and the trigone of the bladder. So we don't know if we're actually causing some trauma to here as well. So I advocate when we teach vet students to desex dogs and spay dogs to make a bigger incision. And I understand that in practice we think that small incisions are good, but really exposure is better, right? And the wound will heal the same rate if it's big or small. So we want to make sure that they've got good exposure and they can really make sure that they can see that tissue and they're not putting undue pressure on other organs in the body trying to exteriorize those tissues, which might even go back to the way where we say, well, do we remove ovaries and part of the uterus and leave the little bits of the stump in? But anyway, that's something that we see. So obviously we know that if there are less than 20 kilo dogs, they've got a 10% risk, and if they weigh 20 kilos or more, they've got an increased risk of developing urinary incontinence. And spaying shortly before puberty reduces this risk by 50%, which is really important, right? So it's something that may happen. Now, again, I said the pathophysiology is still unclear, but the research is beginning to show that that LH receptors may play a role in this as well. And we can see here, this was one of the papers that talked about the expression of LH and FSH receptors of the lower urinary tract. And they look at the difference between intact animals. So the intact animals are here and here, and then obviously our spay group is here and here. Now our black arrows and our dark thin arrows show the level of expression and of our FSH and LH receptors versus our spayed animals, where we've got similar less expression to minimal expression when we've desexed them. So this was using mRNA for FSH and LH receptors. And then we can see as well, if we looked at immunohistochemistry for FSH and LH receptors, we can see too, our intact animals have more expression than our spayed counterparts. So in cats, the most common medical concern was the possibility of increased of fluted with early age desexing or early age neutering. Multiple studies failed to find a link between the two. So we sort of, at the moment, the consensus is that it doesn't affect fluted cats. And pubertal desexing found no increased risk of fluted between the two. Now, what about metabolism? So we all know that once we desex animals, that they increase weight, and you know, there's been discussion about metabolic diets to try and counteract this, or exercise, or reduced feed intake, right? And neutered animals may gain significantly more weight as compared to their intact animals, and cats are 3.4 times more likely to become obese if they've been desexed. And less than 6 months has a lower prevalence of obesity than greater than 6 months. So cats also have a 2 to 9-fold increase risk of developing diabetes as well than their intact cats. So there's I guess pros and cons each way in relation to metabolism and desexing. In dogs, we see that up to 68% of gonectomized dogs are obese. And they think that there's two main reasons for this: an increase in appetite and a decreased metabolic rate. And then they normally have a 20% increase in food intake within 1 week of desexing. And bitches experience an altered glucose metabolism, can be induced by progesterone. And if that happens, spaying is one of the treatments that we do this, right? But if we gonadectomize these animals, it results in a 30% decrease in daily energy requirements. So we need to make sure that if that happens, we're considering that. And the current research, I guess, is leading towards this idea of LH, that LH receptors are found in the gastrointestinal tract. And then they might have play a role in the increases of glucagon release, and also that there's multiple LH receptors in the hypothalamus, and these might be involved in increasing in appetite, resulting in hyperphagia, increasing their want to eat, and that when they blocked these, so they've reduced this increase of LH. Once being desexed, they found that there was a decrease in food intake. So there's an initial thought that it might be, and this is early work, but there's an initial thought that this might be that the increase in LH may have an effect on the intake of food and potential metabolism in these animals. So if we look at the musculoskeletal system, growth rate in cats specifically was unaffected by the time of neutering, but we do know that physeal closure is delayed. So growth rate is genetic, and they'll grow to their genetic potential, but we can still have an effect on their musculoskeletal system when they're at the time of desexing. And cats are at an increased risk of a femoral capital physeal fracture, but there's other factors that are involved in it as well, including gender, obviously their reproductive status, if they're desexed or not, the delayed physeal closure itself, and obesity. So there's more than just saying desexing, in this case, has an effect on these animals. If we look at hip dysplasia, and obviously hip dysplasia is one of the big things that we worry about in certain breeds of dogs and large animal dogs, and there is a possible influence in the age of neutering and hip dysplasia. Now we know that hip dysplasia is genetic, but there's also an influence in the age of desexing that they think, as well as the genetic influence as well. So neuter boxers, for example, were 1.5 times likely to develop hip dysplasia than their intact dogs. And they found in a study that puppies that were neutered before 5.5 months of age had a 6.7% incidence of chronic hip dysplasia, where if they were neutered between 5.5 and 1 year, so they were allowed to grow a bit more, had a reduced rate of chronic hip dysplasia. So hip dysplasia was one that that is starting to be to be researched and to be investigated more. And since then, they've published out of Oregon State University, Michelle Cookler, a colleague of ours. She's had a grad student who's published a paper on the expression of LH receptors in the hip complex, so ligament of the head of the femur, and ligament laxity, and found overexpression of LH receptors at time of desexing, after desexing as well. So they're seeing if they're drawing a link between desexing and LH and the incidence of hip dysplasia as well, which is really interesting because at the moment we say desex these dogs because they've got poor hips and we don't want them to be bred from, but is that causing them to experience the disease sooner or more profound? And that's, I guess, what the current literature is currently investigating. Cruciate disease, so here's another one. Cruciate disease. Obviously, there's significant increases in the prevalence of cruciate rupture, and we know that males and females have differences in their in cruciate ruptures respectively, and there's some evidence that not just LH but estrogen and relaxation may play a role in altering cranial cruciate ligaments laxity, and may be a part of a risk, part of the risk of the rupture and the disease process. Now, interestingly, humans, there's an increased incidence in cruciate rupture in humans with increases in estrogen, so which is different to what we think about with dogs, but it's something that we haven't identified in dogs as well. And again, Michelle Kutzler, she's had another grad student who's been looking at LH receptors in the cruciate ligament as well, and found an expression in the ligaments and an overexpression once they've been desexed. So they're trying to look for the link between age of desexing and when the disease process occurs. And we know from previous papers that intact animals only have half the risk of cruciate disease than their desexed counterparts. But again, there's other factors, conformation, age, their weight, so if they're obese or not. There's other factors as well, and do appreciate that there are other factors, but part of the disease, part of the pathophysiology or the disease may also be because of desexing of gonadal removal and the time of these gonads have been removed. Now, if we talk about tumour development, so obviously osteosarcs are a highly malignant tumour, and mainly they're in large breed dogs, and we've seen a twofold increase in this risk in neutered animals, right? And they've done studies to show that gonectomized dogs in that study lived longer than their intact dogs, but so that's why they thought that they might have that increase in the disease, right? So yes, you get an increased risk, but is it because they were living longer, or is it because that other tumours or other disease processes were suppressed and then they succumb to this disease? And that's the bit that they're not really sure about at the moment. Now, they know that sex hormones influence bone sarcomatogenesis, and it can also have an effect on lymphosarcoma and mastocytomas as well. And early neutering can increase this risk. So they can increase it by 3 to 4 times the risk of getting it if they're not done early, right? And also, again, Michelle Kutzler found that there was LH receptors on lymphocytes and lymphoid tissue and in the skin, and these tumours, once these animals were desexed, had an overexpression of these receptors, and when they were evaluated for animals that had these diseases, they found this overexpression was linked again towards the pathogenesis of the disease. So they don't know again if that increases your risk or not, but they know that it may have an effect. And the current understanding is that they think that it may have an effect, but they haven't got to the point of survival times and incidences of intact versus gonad-ectomized animals and those LH receptors, but they're starting to do the work now because they're starting to see a link. So this was a paper that was published in 2013, and it looked at the effects of joint disorders and cancers in golden retrievers. And you can see here, if I get our little pointer, we can see here we've got hip dysplasia, cruciate disease, lymphosarcoma, hemangiosarcoma, mast cell tumour in males and females. And if we look at our intact versus our early neutered and our late neutered, we can see that the differences in disease percentages of animals that had diseases. So there is an effect, you can see generally an effect of leaving some of these dogs entire. Obviously some diseases also, neutering them late might have had an effect as well. But what was really interesting was, for the majority, neutering early is a bit of is something that was showing that there was an increased incidence of disease in this breed specifically, and that's the important part, right? So there's no one size fits all for all of this. Some of it's got to do with breed specific things, some of it's got to do with the whole a whole population of dogs. But what was interesting is that they're starting to look into these individually to see. So when we are presented with our dogs of different breeds, we need to think about, well, what are these dogs predisposed to, and when should we consider discussing desexing or not, or the time that we should be desexing them. So an interesting one that came out in 2018 was the effect of desexing on intravertebral disc disease or herniation, Dachshund specifically, right? And there was a study that in the UK that they looked at that the neutering status as a risk factor for intravertebral, I'll call it intravertebral disc disease, but it's a herniation in Dachshunds. And neutered females had a significantly higher risk than their entire females. And same, and neutered was compared with the entire Dachshunds was increased, but it wasn't statistically significant, but it was still increased. So for both genders, the study demonstrated significantly increased risks of intravertebral disc herniation in early neutered Dachshunds before 12 months as compared to those that were neutered late after 12 months. So delaying desexing in these Dachshunds reduced the incidence of intravertebral disc herniation. They're not saying that leaving them entire had for longer had an effect, but delaying desexing had an effect as well. And if we look at this graph here, we can see in our dogs and bitches the incidences if we were desexing them early versus late, right? And early, oh sorry, I'm going to get my point here. And you can see here are our males and here are our females. And you can see that if they were neutered early, they have an increased risk of developing the disease compared to their unneutered counterparts. So that was really interesting because, you know, for a long time we blamed conformation as one of the causes of, the main cause of disc herniation, conformation, weight in Dachshunds. But now we can start to think, well, is the time of desexing one of these as well? Is that going to have an effect? And can we attribute maybe, you know, delaying our desexing in these breeds longer to help prevent or reduce the risk of disc herniation later in life? So one of the most, I guess, most asked questions we get is about lifespan. And if we talk about, if you look at the literature across the board, from the early literature to now, lifespan has changed. So initially in the 60s, 70s, 80s, the initial lifespan was desexed animals live longer. Then they did some studies, you know, in the early 2000s, and found that actually there's a benefit as well from having gonadal sex steroids in place and in the body. And for example, they did two studies here where they looked at a cohort of Rottweilers, and they were using this as a model for human women leaving ovaries in or not versus hysterectomies versus ovarian hysterectomies. And they found in this cohort of Rottweilers that the entire animal lived longer. They lived up to 30% longer and had less cancers than their desexed animals in a cohort of Rottweilers, I need to say, right? So that was a breed-specific thing. Now, they also found that a moderate investment in reproduction may promote longevity, but that's not saying that each Rottweiler has to have a litter to prolong its lifespan, and that's not what they were saying at all. They just said that some out of the numbers that they had, some of them had litters, lived longer, but also the ones that didn't have litters also lived at those same lifespans as well. But they found that a moderate investment may promote longevity as well. And that moderate investment might have also been why they had their gonads left in longer as well, which may contribute to the longevity of these dogs. Cancer cause of death was significant in the D-sex group, but longevity was what the entire dogs succumbed to, and so they died of less cancer than their D-sex counterparts, which is really, really interesting. So what does this all mean? And this is the hard part, right? So there's no one-size-fits-all answer, and I've given this talk a bunch of times now at conferences in Australia and overseas, and we've had roundtable discussions with professors from universities in the States and Australia and clinicians, and what have we come to? Well, we've come to that there's no one-size-fits-all answer, and unfortunately, you can't just put a blanket rule these days and say, righto, 6 months is the time that every animal should be desexed, and it really depends based on what you're presented with. And that's really important to know. If you're presented with a Great Dane, that Great Dane is going to have a different set of considerations than, say, a Chihuahua or a French Bulldog or a British Bulldog, right? They're two totally different dogs. So we need to accept that we can't pick one number for everything or one scenario for every animal and leave it at that. Client education is vital. And we know this now, right? So our clients are becoming more educated, and they are coming with more answers, more questions, and they're finding answers on Google. And as I said at the start, not all answers on Google are correct. And it's our job to be abreast of literature, or be able to present them with the facts and the science and say, let's come together to an agreement about what you want to do, and build that relationship with the client. So if we don't desex these animals, that's okay. But we might have them come back twice a year for a health check or an abdominal ultrasound to make sure that they don't have a pyometra, until we've agreed of the age that they, would benefit from being desexed as one management tool, right? We also need to consider what the owner can manage, right? So diligent versus less diligent owners, right? So now we've got owners that are professional and their dog is a member of the household, and they might not have children, and their dog is essentially their child to them. So we need to, instead of saying we just need to desex them, we need to make all of these considerations and discuss that with them to make sure that both they are aware of when these animals are getting desexed, and two, that we've presented them all the science, so that that we're doing the best thing by that animal. Obviously, less diligent owners, it's a little bit harder. So if an owner comes to you and they can't manage that, well, sometimes the best thing for the dog is desexing early, and it might be that benefit will outweigh the risks of everything else, and that might help get that animal off the stray list or off the being surrendered or whatever, right? So we need to consider all of those factors of what the owners can manage, because essentially at the end of it all, if we are not taking the consideration of what they can deal with, then we're essentially influencing what the life of that animal is going to be like at home. And as I said to you at the start, some owners might not want dogs spraying or bitches bleeding in season twice a year and not be able to handle that. So sometimes we might need to be able to educate them early on that, and then they can make a decision. we've touched on the influence of LH and sex steroids, and LH is the is at the moment one of the up and coming areas of interest, right? So what effect does the reduction of negative feedback from where the gonads would be on the pituitary and the overexpression of LH have on these other disease processes, knowing now that they're finding LH receptors in these areas that are overexpressed? Are they contributing to the pathophysiology? Are they contributing to our increased incidences? And then the next question is, well, can we do anything to reduce the LH? And we can do things to reduce the LH. The question is, what will that then do? And do we know if that actually works yet? And that's the area that is also being touched on by Michelle Kutzler and her group over in Oregon, is that what happens if we then suppress this LH after they've been desexed? Are we seeing these incidences increase, reduce? Are we seeing the receptors being overexpressed or reduction in the expression, or going back to a normal state, or even to a less than normal state? And does that less than normal state have an effect? We don't know what that is yet, but that's a possibility. So from here, well, we need to start to think about these things, right? And the research is being done, but what we also need to do is we need to come to the consensus that there's no one model fits all for all these dogs. And we need to consider each animal on its merits individually, and come to an agreement with our clients, as in what's the best thing for this animal, and when should we be desexing these animals. Right, thank you. There's a lot of stuff there. Have we got questions? I think we might have a few questions.
Hi Xavier, yes, we have a few. We have pages of questions actually. Thank you very much for that lecture. I think it's got everyone thinking and talking, which is great. Depends how long you have, but we'll try to chug through a couple of these questions, and if we've run out of time, I guess we can email them to you and see how we go from there.
Sure.
Okay, so I'm going to start with some of the earlier questions. Jose asks, is there a concrete recommendation to perform only an ovarectomy in young females versus a complete OVH? I guess, is it an individual decision? Are there pros and cons? What are the risks of leaving a uterus in?
Yeah, it's a really good question. And we discussed that a little bit before, right? So remember that once we remove those gonads, and there's no endogenous, meaning internal, release of hormones, sex steroids, from the gonads to the uterine tissue or testicular tissue, whatever, then they are essentially lying dormant. So if you just took ovaries out, that's fine. But remember, if that uterus is diseased, if there's a pyometra in there, or in an older dog, then fine. We should probably be taking the whole lot out because there's pathology there. But if you've got a young, healthy animal and you took out ovaries and part of that, and you took out the whole ovary, so you didn't leave a remnant in, but the whole ovary, and you removed part of that uterine tissue or left it in there, there's no chance that that dog's going to get a pyometra, because a pyometra can only occur under the high influence of progesterone. And the progesterone only comes from the ovary, from an ovulated follicle. If that ovary is not there, so there can't be a follicle to ovulate, then we can't get a pyo by definition. Now, if you were to estrogenize that dog, yes, you will get a stimulation of uterine tissue, but again, we're not going to get a pyometra because we're not going to have the influence of progesterone, which will allow the immune system to wall off the uterus and bugs to grow, but it will cause other problems like uterine discharge and proliferation of the endometrium and potential tumours of the uterus. But again, treating dogs with estrogen is less common in using it for diseases than that we normally do. So it's up to you in removing that in the ovary versus the whole tract. I mean, again, if it's your preference to get in and take the ovaries out and leave the majority of the uterus in there, it should be absolutely fine. So it's sort of up to you.
Okay, thank you for clearing that up. We've got a few questions that kind of, I guess, involve the same line of thought. Caroline asks, what are the long-term effects of leaving a redundant uterus in a dog and a cat, but what about also for small furries, for example, ferrets, guinea pigs? Does leaving it in or does removing it influence the risk of uterine neoplasia?
Yeah, it's a good question, and I'd have to, for ferrets, guinea pigs and rabbits, I would have to look into that more, but I do recall discussions in rabbits that uterine tumours are the most common, and I think they were leiomyosarcomas, and you need to remove gonads and the uterus for that one. So, maybe in those animals do it, like remove the whole lot. Me personally, we don't see rabbits in Queensland, so can't really comment too much on that. But, if you're worried, take the whole thing out.
Thank you. Caroline also asks, is it proven that neutering big dogs earlier can predispose to cruciate disease? But then there are other questions with regards to is the increase in cruciate laxity that you spoke about due to these dogs being more likely to be overweight?
Yeah, there is, right. So again, right, you got to remember that there's multiple factors in these disease processes, and gonadectomy is only one little part of the whole picture, right? So yes, conformation, yes, obesity, yes, age of desexing, yes, genetic predisposition as well. They all have an effect, right? So if you were presented with a Great Dane or a Bull Arab or a Bull Mastiff or something, you'd be better off. You would have a decreased incidence, so literature tells you, to leave the gonads in longer than, say, a smaller animal like a French bulldog or something like that. I mean, I'm not saying that these dogs aren't going to do cruciates if you leave them entire. The literature reports a decreased incidence when they're entire. But there's many other factors. There's also what do you do with the animal? Is it a working dog? Is it a pet that doesn't run around all day? I mean, it's does it jump off the third story of the third rung of your stairs? I mean, there's no one size fits all for that one, unfortunately. But they do know that there's evidence that shows that that gonadectomy can have an effect on the incidence.
Thank you. I know you said, and you've touched on it many times during your presentation, that there's not a one-size-fits-all for when you desex or if you should desex. Mm-hmm. But can you kind of say that it is of a benefit, based on the information you provided today, to leave animals to have one season before getting them desexed if the owner is planning on desexing them, to decrease the risks of various diseases you discussed?
Potentially, right. But again, I guess that we need to consider a number of things. So, breed of the dog, are these dogs at risk of? What are the concerns of the client? So if I can use mammary tumours as an example. So I remember recently having a client come to us who mentioned that they wanted to have their dog desexed because they were concerned of mammary tumours, and they have had, in the line of bitches that they had, all of these bitches had developed mammary tumours. So this was a pup out of the litter, and she wanted to desex early, no matter what, because she wanted to reduce the incidence of mammary tumour. So in that case, we're like, well, yes, it does, okay, that fits with you, yes, we'll do it, right? But there's other things that we need to consider as well, depending on the breed and other genetic predispositions, we could say, or other disease processes that the dog can get. So in that case, again, we present all the information to the owners, and then they're able to make a decision with us on what they want to do.
Great, thank you. And in that line of thinking as well, when you talk about each breed and what priority the owner has as well, for example, with urethral sphincter mechanism incompetence, just off the top of my head, Dobermans are setters, they're at a far higher risk, I believe. Cats are my thing, but I'm just trying to engage my dog brain. So with those breeds, would you suggest letting them have a season if that is a risk in that breed? And with regards to different breeds, is there a source or a table that you could refer us to have a look at?
It's a great question.
To really guide our
unfortunately. And it would be great if there was a table, right? And maybe it's something that we should all think about doing. But at the moment we don't.
PhD.
We don't have enough information, which is unfortunate. And individual breed studies are starting to come out. And all I can say is, we can refer to those. But yeah, unfortunately, there's no summary table at the moment that we can look at, which would be really good, right? And it might be something that we can consider doing sometime. It'll take a long time, but at the moment, no, sorry, there isn't. So I guess individual case-by-case basis, consider the breed, consider, depending on what you're worried about, maybe the conformation of the dog or its behaviour or whatever, and then, discuss that with the owner and go from there.
Great, thank you. Michelle asks about large breed dogs. She's seeing a lot of larger dogs that are developing urinary incontinence at a younger age than what she's seen previously, and these particular dogs from questioning have been spayed very early, like at 8 to 12 weeks by the breeders before sale. Are you seeing any of these?
Yes, and it's a really good point, and I am seeing this, and it's not a fault of veterinarians, but it's a pressure that we're being put on by breeders to de-sex dogs really early because they don't want their lines bred from, which is what we are seeing more and more. And we are seeing that, but we're not just seeing urinary incontinence. We're also seeing vaginitis and increases in urinary tract infections as well because of poor conformation, perivulvar dermatitis. There's a number of things that occur. So yes, we are. And I talk to a lot of breeders as well, and I talk to a lot of breeder seminars, and it's really hard to convince them otherwise. But I'm finding more and more that if we present the science to these breeders, that they do take it on board, and they do start to listen and understand. And let's go the other way, right? So yes, they want to de-sex these animals early because they are worried about their dogs being bred on, and they, have contracts and all this sort of stuff and whatever, and I try not to get involved in that. But as a profession, maybe we need to be looking at other ways of sterilising these animals early so they can't be bred from, but they can have some effect of gonads being in place, to allow them to develop further before we do get them de-sexed. Now, what's the answer? Don't know yet exactly. Maybe in the male, at least we know we can use a supralorin implant and we can, stop spermatogenesis for a period of time. But in the female, it's really hard at the moment. And, a lot of hormonal therapies that we give bitches can cause uterine pathology or can have effects on the gonads or the hypothalamic pituitary axis, causing unwanted side effects as well. So males a little bit easier, females a little bit harder, and I guess that's the area of research that we need to start to think about too, is how can we offer them other ways of reducing reproductive capability, but still having them having the benefits of sex steroids in there so they can continue to develop. And maybe
thank you. Yes, not an easy question.
Maybe I can touch on something. I should continue there really quickly. So that then leads to the question: what about ovarian sparing space? So people say in bitches, what if I leave the ovaries in and take out the whole uterus, right? And that's fine. If there's no uterine tissue, you've got rid of the all of the uterine tissue down to the level of cervix, then technically there's no chance of a pyometra or even a stump pyometra because there's no uterine gland there, so there should be no stimulation, no chance of a pyometra. But what if, and it's a question that we've been discussing not just in Australia but around the world, what if you've got a dog that's entire, with her ovaries in, she goes to the dog park and then mates with another male? What does that then do to that bitch, right? So she no longer has reproductive tubes. It stops at the level of the cervix. And those dogs tie, turn, and then the dog ejects his three sperm, his three ejaculate fractions into the bitch. And they can produce up to 50 to 60 mils of prostatic fluid. Where does that all go? And then does that cause a rupture at the level of the cervix where we've removed the uterus? And then does that mean the bitch then gets sperm peritonitis? We don't know yet. There's discussions about, is this starting? So the next thing is then, well, are ovario-sparing spays a good option? And the answer is we don't exactly know yet. So it's something that we need to think about and investigate and worry about more. And I guess, again, comes back to the client. What can the client manage, and having that discussion with the client. Cool. Sorry, I thought I should add that because it's something that we get asked a lot.
I don't think that thought has ever crossed my mind, but thank you for touching on it. We've got a couple of other questions here if you have a moment. Caroline asks, occasionally she's had bitches with long-term vaginal discharge after cesarean. Do you know what the reason of this
After cesarean? Was it? Yeah, so bitches get a disease called subinvolution of placental sites. And generally, if you've got prolonged discharge, as in for to her next season, blood-tinged discharge, then potentially is that. I mean, it's really hard to say, right? There's a number of factors that can be involved in uterine discharge post-cesarean. Loci is normal, and it can go on for weeks, 2 to 3 weeks. That's quite normal, but a post-cesarean one, generally, if it's like significantly prolonged to her next cycle, it's generally subinvolution of placental sites, which is a whole different topic to now, but yeah.
Okay, so subinvolution of placental
sites,
did you say? Oh, yeah. Okay. Michelle asks, will treating a bitch for urinary incontinence with estrogen supplementation, so silbestrol or Incurin, increase the incidence of pyometra if she has only had an ovarectomy rather than a ovariohysterectomy?
The answer is we don't know, but yes, potentially. Estrogens, there's a preface to this, if there's uterine tissue still there. So if we go back to the pathophysiology of a pyometra, so you have to have ovaries, you have to have uterine tissue, and the ovaries, the pyometra doesn't come from estrogen, and it doesn't come it doesn't come from the follicles. It comes from high progesterone and trapped bacteria in the uterus when the cervix closes. So a pyometra can occur because of delayed clearance of uterine tissue, of uterine contents at the end of estrus, which is a normal process, and a decrease in neutrophilic, invasion into the uterus to remove that bacteria. And there's a number of processes that remove that. A lot of this research comes from the horses and endometritis, but in the dog, they don't have to get a pyometra with cystic endometrial hyperplasia. They are predisposed to it if they have cystic endometrial hyperplasia because the cysts delay the clearance, but they can get a pyometra and have a totally normal uterus. And I've seen bitches first season at 6 months of age with a full-blown pyometra and no cysts involved at all, right? So if you were to give estrogen and had some uterine tissue there, doesn't matter if the ovaries are in or not, you'll superstimulate that tissue a little bit, but that doesn't predispose you to a pyometra unless you've got a level of progesterone, and that progesterone then depends on where the bitch is in her cycle. So you can give her estrogen in the middle of her cycle, when she's in anestrus and has 0 progesterone, and it won't matter. But if you were to superstimulate her with some estrogen while she's in season, then there's uterine tissue there, and you've got bacteria in there, then yes, there's a chance that you'll get a pyometra. But I guess, they haven't done studies to take out the uterus, leave a stump in, give them heaps of estrogen and see if they get a pyo. But if you think about the pathophysiology, that better answers the question.
Thank you. I think we have time for one more, which may be a whole lecture in itself, but Matt asks how desexing influences anxiety or behavioural issues with the dog.
Sorry, I missed that one. Can you say that again?
The influence of desexing time on a dog with anxiety or behavioural issues.
Yeah, really good. Look, I didn't touch on behaviour because behaviour is really hard, right? And it's hard to quantify behaviour, and I'm not a behaviourist. So I've read mixed reports. Some reports say that you desex dogs and it reduces anxiety. Some reports say you desex dogs and it increases anxiety. So when it comes to behaviour, I think there are better people to talk about behaviour than me. So I'd probably refer you to a behaviour specialist than myself. Sorry.
Yeah. It's a big question. Thank you so much for answering all of those questions for us, Xavier.
It's okay. Look, again, right, if people have questions, feel free to send us an email. We'll get back to you slowly and surely. But we're more than welcome to talk. And if you just send emails across, we can slowly get to them and help wherever we can.
Brilliant, excellent. We'll pop your email up on the chat in a moment. A lot of thank yous coming in there. That was a really wonderful lecture. It really got everyone thinking. So thank you so much, Xavier, for that, and also to Michelle Murdoch from Verbac for organising that for us, and to everyone for coming along tonight and asking lots of really stimulating questions. I hope you all enjoy the remainder of the evening and have a good night.